Welcome back. Over 1,400 people died from drug overdoses in Missouri in 2024, with many losing their lives from fentanyl. And St. Louis City continues to have the highest mortality rate in the state. One St. Louis father has made it his mission to save lives in honor of his own son, and he wants you to be a part of this fight to end this public health crisis. So we're joined now with Jim Wilfred. Jim, always good to see you. Thank you so much for joining us again.
Thank you, Mercedes.
Of course, we met last year when you told me about your son, Austin. So just as a reminder for people who may not know you and your mission, talk to me about Austin.
Austin was 23 when he was killed by poisoning with fentanyl. Good kid, was out putting out petitions everywhere, always wanted to do the best. He was an advocate, and I just follow in his footsteps, actually.
And you've created a nonprofit. Talk a little bit about that and how you're helping people just like Austin and exactly what he wanted to do.
Yeah, Second Chance at Life is the name of my nonprofit. I created it to help. First was to bring awareness to fentanyl and the dangers of it and how easy it is to die, not even knowing what you're taking. Secondary is to help get people to treatment who may be suffering with substance use disorder, get them there any way they can, because it's so hard sometimes to navigate the world, and which is just the right help you can get in right away.
And we were talking about the numbers before we came on air. I know it's going down, but just tell me about, you said 250 people a day? 250
people a day is about what's still dying. And it's just, I know it's talked about a lot and there's a lot being done, but it's not enough when there's still 250 people dying a day.
No.
You know, there's still a lot to be done. And that's why we can't slow this momentum down of doing things.
And so when we talk about that, talk about Walk for Lives.
Okay, so Walk for Lives is a national movement put on by United Against Fentanyl. We have over 100 cities this year that's going to be doing the walk on the same day, July 11th at 9:30 a.m. And it's primarily three functions. One is to raise awareness to the dangers of fentanyl, and two is to honor the victims of those that have been lost. And then three is to bring together the community and do some networking so we can all work together to show our resources and share our resources and let each other know what we do.
And you said you're hoping it's going to be even bigger this year. The DEA is coming out, so talk to me a little bit about that.
Right, the DEA has decided to collaborate with us, so they're coming out to the walk. They've done a fantastic job of getting a lot of the drugs off the streets. They've got an outreach diversion control agent they call, and he's going to be coming out, and we're looking forward to the partnership with them.
Tell me a little bit about the time, location, and what people can expect when they head out to this walk.
So 9:30 is start time. It's at Chain of Rocks Bridge Park. Beautiful park's just been opened. We got the whole park. There'll be a couple speak, and then at 10 o'clock we're going to take a walk out onto the bridge and back, approximately a mile walk, and people will be carrying posters and signs and honoring loved ones. And then we'll come back and people will speak about loved ones they've lost. The DEA will speak, the Department of Behavioral Health will speak, a senator, representative. And at the same time, there'll be all these vendors out there that are from Department of Mental Health, the treatment centers, sobriety homes, just showing their services and what they have and how they can help.
What kind of environment does this bring, and what do people leave with? I'm sure this is a really impactful day and it touches a lot of people when they leave. So tell me what you felt and what you've seen people feel the last few years.
Love. There's a lot of love, because when you lose someone, when you lose a child especially, you feel like nobody understands. Mm-hmm. And so you get connected in ways that are unexplainable. It's like a family, and so we all get to come together and we get to share our missions. Even the people that are doing the other service work, you know, we get to come together and we get to serve those that we serve and watch somebody get help. And it's a really good thing. And you know, I want to express, this is not a fundraiser. I'm not asking for money for anything. This is just straight outright outreach to bring awareness and honor those who've been lost.
What do you want people to understand about this public health crisis?
It's dangerous. It's real dangerous. You hear people dying every day. One pill can kill. That's what the saying is, and it's so true. And it's just don't take anything that isn't prescribed. It's in the weed, it's in the coke, it's in the meth, it's in the pills, and you still hear about people dying every single day.
And you're doing such a good job with your nonprofit, and I know this is something that your son wanted to do. You've told me. So do you feel him every day when you
Yeah.
are doing this mission and this work?
Sometimes when I'm down, it gets overwhelming. You get to do so much stuff, and you try to keep going, and you just feel like you just want to give up. And I just feel him say, "No, Dad, keep going."
I know I didn't know him, but I know he has to be so proud of you. And it's always amazing when you see someone with the loss that you've experienced turn it around and try to help others. So I know there's a lot of people watching who really appreciate what you do. Just what you're doing is saving lives. So thank you so much.
Yeah, thank you.
Always good to see you, Jim.